Welcome to the Healthy Hustling Podcast. I am Dr. Eric Broadworth, and today I've got with me Dr. Matt Zitny. Matt is a physical therapist at Fuel Health and Wellness. He joined our team back in May. It's August 2nd, 2024, and he joined mid-May, really. And so he is the center manager at our Granville clinic. Matt has an extensive background and he specializes in working with overhead athletes, especially those that are like in baseball, really specialized in that. And then a really cool topic, he is the only male men's pelvic floor physical therapist in the state of Michigan. So he brings just a wealth of knowledge to the team on that specific topic. And that's what we're really going to focus on today is men's pelvic floor and what does that entail and who should maybe be seeking out treatment for that. So thanks for coming out, Matt.
Yeah, hey Eric, thanks for having me on today. I'm excited to talk about men's pelvic health. It's a super tough topic for a lot of people to talk about. So I'm excited to kind of open the doors on that and help people understand what is men's pelvic health and why it's important to talk about it.
Yeah, how did you get into working with pelvic floor for men and stuff? And a lot of people have heard of pelvic floor therapy, right, for women, but a lot of people don't really realize like, hey, men have a pelvic floor too, and they can have issues that can have um, if they have issues with it can have a number of effects. So how'd you get into that?
Yeah, so honestly, I got into it because I have friends who have pelvic floor health issues. And it's more comfortable to talk, at least I think it's more comfortable to talk guy to guy. And then talking to some like old female colleagues who like specialize in pelvic floor treatment, like, hey, why, or are there any men that treat this, or are there guys that do this stuff? And then I started really looking into it and realized, there's no men in West Michigan for sure. And I don't think in the entire state who are specialized in treating it. So I'm like, why does somebody not do this? Um, it's not that hard to talk about. It's not that hard to get like educated in. It's obviously a sensitive topics, but I think it's important that there's men that seek help from other men if they need it, and that's really why I took the courses I took and got educated so that I could help other men feel more comfortable in their own skin and talking about pelvic floor.
Yeah, and which courses did you take? Just especially if patients don't, maybe they care about the course, maybe they don't, but if
Yeah.
other physical therapists wanted to take it, would you recommend the course?
Yeah, so I took courses through Herman Wallace. Excellent company. They are really, really well educated. I actually had a sponsor who was from Grand Rapids, which was great. She was super helpful, and we still touch base here and then, which is really, really helpful for me. But Herman Wallace has excellent men's health courses and super informative for your general pelvic health courses to pelvic floor for athletes specifically. So they offer a lot. Really great educational group.
Nice. So let's get into some of the basics. Like, what is the pelvic floor?
Yeah. So really to simplify it, the pelvic floor for men and women really is a group of muscles, ligaments, nerves, fascial layers that support our bowel, bladders, and sexual function, right? So the muscles are kind of broken into three different layers, starting from like superficial to getting deeper. And they all have their own function and like operate their own ways. So whether it's from just like giving us support on our spine or giving us support in our pelvic girdle, to helping things such as like incontinence, right? One big thing to note with the pelvic floor is that the nerves, the blood flow, a lot of the main arteries and vessels start in our lumbar spine. So it's super important to be familiar with, the patient in front of you as a whole, because if you're, not thinking about what their lumbar spine looks like or what their hips look like, you can really miss a lot of information because all of the nerves and vessels are highly connected.
Uh,
So a lot of stuff in that pelvic floor.
Is it appropriate to think about, so when I think of, our, and how I tell patients to think about it as far as our core, more so being like a can versus a lot of people think just abdominals, right? But our core is really like a can. And so you've got your abdominal wall, you've got your obliques, you've got your back. That's all a part of kind of the can. But then you have the top of the can, which is your diaphragm, really, and then the bottom of the can being that pelvic floor. Is that how you like to explain it and think of it for patients? Would that be
Yeah,
appropriate?
absolutely. So it's easy to think about it that way because when we're talking about breathing, you can breathing is a huge topic in pelvic floor to like understand how to contract, relax, and then incorporate breathing into that. But when you're thinking about a can, it's a three-dimensional object, right? So if I'm telling somebody to breathe into the bottom of the can or fill up the sides of the can, it's a good visualization, and it's easier to understand that versus say, hey, just breathe into your pelvic floor. Nobody knows what that means. So using like a can visual is a great tool and I use it all the time.
Okay, awesome. And then so when we talk about dysfunction, what's pelvic floor dysfunction? What does that typically look like?
Yeah. So really it widely varies based on, what the patient presents with. But really to simplify it as much as possible, it can be a dysfunction from a muscle group, from, our prostate. But a lot of issues in our pelvic floor can be stemmed from poor control with, learning how to contract a muscle or poor control learning how to relax the muscle. Like if you're tense and tight all the time, we need to learn how to relax that. Or if you have absolutely no control over contracting or like, cutting off your P flow, you have to know how to do that to have good pelvic floor function and control. Dysfunction can come from that, like the muscle groups, or it could even come from, the inability to have blood flow there, which can be from lack of blood flow in the vessels, or it can be from tight fascial tissues in your hips or a tight lumbar spine, tight thoracolumbar spine. Really a lot of causes to pelvic floor dysfunction.
And then it's obviously pretty important to like weed out and see where exactly is this coming from, correct?
Yeah, absolutely. So, for example, like a hockey player, if they come in with some deep growing pain, some deep pelvic pain, is it a labral issue or is it a pelvic floor issue? There's a good chance that it could be a labral problem presenting as a pelvic floor dysfunction or vice versa. So it's very important to look at the anatomy of the hips, the spine. It's definitely not just, looking at it under a microscope. You have to really use a wide lens when you're treating pelvic floor.
So you mentioned a little bit of some of the causes. Are there any other causes typically? Any cardiovascular issues that you see pop up in pelvic floor dysfunction? Just curious.
Yeah, so there definitely are. Like weight, being obese, poor diet and exercise, hormonal imbalances. There can be a lot of causes of pelvic floor dysfunction. So, low testosterone is another one. Prior back surgery, prior hip surgery, any sort of like crush injuries in the past. Advancing age can be a cause for pelvic floor dysfunction. So there's tons of causes. I mean, it can be as simple as what you're eating and lack of diet and exercise can cause fascial restrictions. Therefore, our pelvic floor doesn't function as well as it should. So there's a really lot of causes to pelvic floor issues.
Okay. And so what are some of the symptoms that people might be getting? What should they look out for? So if you're a guy and you're thinking, hey, do I have pelvic floor dysfunction? What are some of the symptoms
Yes,
of that?
absolutely. So again, symptoms widely range, right? So it could be, burning with urination. It could be painful bowel movements. It could be the inability to like maintain or sustain an erection. It could be deep back pain that like is not going away for a really long period of time, or sharp burning pains in our pelvic girdle. Anterior hip pain can be a sign symptom. The inability to like stop your pee flow if like you're going pee and then realize like, oh my gosh, I just peed on myself. Like, yep, that is probably a pelvic floor dysfunction, like learning how to control that. So there's tons of signs and symptoms, but pain, I would say, would be the biggest like red flag. Like if I have pain with urination or bowel movements or pain with sex, like those are big issues that we need to address. We don't want to just like let those linger around. It just gets harder for everybody to treat that.
Yeah, that all makes sense. I think that is super helpful on being able to break it down on what to look for.
Mhm.
One of the things is chronic pelvic pain syndrome. What is that?
Yeah. So if we break that down a little bit, chronic pain means something that's going on for a long period of time, right? So if I have pelvic pain or low back pain that's, achy, super sharp, deep abdominal pain, low back pain when I'm sitting, standing, walking, changing positions. Um, if it's been going on for a really long period of time, that kind of puts us in a group of chronic pain disorders, whether it's from our low back or from the hips or from the pelvic floor. But really, chronic pelvic pain is when that pain in your pelvis is going on for a super long period of time. And a lot of times, chronic pelvic pain is really the painful urination, painful bowel movements, pain with ejaculation or pre ejaculation, or a kind of a dull resting ache all the time, whether you're in a walking position, you're sleeping, if you're laying down, sitting, standing, anything like that can be classified as a chronic pelvic pain dysfunction.
And then I guess are the causes for that different than what you had mentioned previously for pelvic floor dysfunction?
Yeah, so there could be some like common chronic pelvic pain problems could be coming from other organ systems in our body, like inflammation, IBS, kidney stones, chronic constipation. If you have like really bad bowel and gut health, it can refer pain to our pelvic girdle. So again, that directly relates to our diet and our hormone balance. It can be from bacterial infections. It can be again from labral tears in your hip. It could be from disc or nerve issue in your spine. There's so many causes of pelvic floor pain.
That sounds pretty complex. Obviously, that's a lot. And so, as physical therapists, we aren't typically doing the lab work for people. Are you working with uh, physicians to either recommend that they get lab work done as far as like blood work, or um, how do you typically go about that? Because it sounds like obviously like it can be caused by diet, IBS, all these issues. Like if someone doesn't even know that, how do you figure it out?
Yeah, so I definitely always ask, like, when's the last time you saw your primary care physician? A lot of men are like, I don't know, 30 years ago, I don't need to go to the doctor, right? So I always ask that question. That's super important to find out and ask, what does your general health look like? What does your health history look like? And how well do you know your health history is a really important factor. But we've actually started working with Game Day Men's Health, who does blood testing. So I can refer people over there since we don't do any sort of like hormonal testing or anything in office. But so they're a great source of uh, a good source of like referral for us if we need some like lab testing done, if somebody doesn't want to go to their PCP or go to a random walk-in clinic.
Okay, cool. Yeah. The guys at Game Day are definitely they're awesome and is obviously specialize in these type of issues as well. So once we figure out, hey, what's causing the chronic pain, pelvic pain syndrome, and everything like that, is there a cure for it? Like, can you get it to go away completely, or do we just manage it? What are you typically seeing and recommending to people?
Yeah, so I guess it really depends on the cause, right? So if it's like a hormonal or gut problem, we need to treat that and then determine if the pain goes away. Um, it shouldn't come back, I wouldn't think. But if there's, a soft tissue element to it, right? Like we're constantly under tension. Our pelvic floor is just crazy, crazy tight all the time. And that's what's driving our pain. We have to treat that with things like PT. So you can utilize things in management like biofeedback, which will tell us if you're constantly tense or if you don't know how to contract a muscle. We do soft tissue massage or like trigger points in the pelvic floor and the low back, in our hip rotators, a lot of therapeutic exercise. So there's a lot of ways to manage it and treat the symptoms. So then that, like, if I find out that the symptoms are really your root cause, then we treat those. Um, Really, men's health isn't that much different than treating an athlete or treating somebody post-op from an ACL or Tommy John. um, you work on soft tissue, you work on exercise, and you work on neuromuscular control. So learning how to activate your muscles when you need to and learning how to relax them as appropriate as well. There's a lot of high-end modalities that you can use in men's health, and a lot of good research to support those. If you'll hear, we use a class 4 laser to help increase blood flow and reduce pain, which is a fantastic tool. Some places like Game Day will have a shockwave unit. So if we need to, really go directly at the soft tissue structures on the pelvic floor, we can refer out for shockwave. But really you have to look at that patient with a broad lens and say, what is this dysfunction? Where is it coming from? And how am I going to best manage it with them?
Awesome. Yeah, no, that's super helpful. And you've mentioned a little bit of like the low back, breathing. How are those connected? Like, why is that related?
Yeah, so our hypogastric plexus is essentially our nerve roots that function our pelvic girdle, right? So our lower thoracic spine and our sacrum are super important in relation to the pelvic floor. So if somebody has a history of, a lumbar fusion and it doesn't move well, and their whole back is super, super tense and tight, it can directly relate to the nerve mobility and the blood flow mobility. So we have to purely work on the lumbar spine and improve their functional mobility. So then down the chain further, they have improved function. A lot of times I'll have people work on breathing in positions like child's pose or happy baby, or doing things like a cobra or, cat cow, cat camel to improve their general flexibility. Because if we're not treating the nerve roots and the blood flow from like the origination of the source, like we're missing out big time. And your symptoms might come back if we're just treating the symptoms locally at the level. You have to really look at them as a whole and say, okay, where is this chain of effects and how am I going to make it or give them the best outcome?
Yeah, that makes sense. Are you seeing like, so if someone does have a low back fusion, are you seeing that as a pretty common issue, like as a cause? And then if that's fused, are you getting good success with those people?
Yeah, absolutely. So a lot of times with low back stuff, again, I'm going to use that laser, and I'm going to do a lot of soft tissue work, do a lot of lumbar spine mobility work. And they get fantastic results, especially if they learn how to breathe properly. If they can really learn how to engage their core properly with, filling that can with air and controlling their pelvic floor at the same time. Those people are going to get fantastic results if it's stemmed from the low back, if that's their main driver of problem.
Okay, cool. And then I think, when a lot of people they think of pelvic floor dysfunction in men, um, erectile dysfunction, obviously it can be a main cause in a
Oh,
big
yeah.
issue. And we're seeing it become more increasingly common, even with younger people. So can you explain a little bit about erectile dysfunction and how we help with PT, like how physical therapy and your services might be able to help with that?
Yeah, absolutely. So ED is a massive problem, and a lot of people feel uncomfortable talking about it. They don't want to talk about it. They don't want people to know they have ED, right? That's like takes away like your manhood, right? Like, oh, I'm not as strong of a man because I have ED. That's what people think and don't seek help, which is a huge problem. Like, get help. Um, there are tons of types of ED, so it's super important to know kind of what type of ED you have. And that's really how we determine how we're going to treat it with therapy. Um, there's a few different sources of ED. So one's called psychogenic. That's pure like an emotional disconnect. Like I cannot maintain an erection or I can't have sexual function all because of how I'm feeling emotionally. Those people aren't really appropriate for PT until they have the mental aspects treated. So I will refer out to counseling or psychotherapy because that's really out of our scope of practice until they get that under control. And then we can control the, learning how to contract and relax aspects. There's neurogenic, which is, if I have nerve damage in my back or in my pelvic girdle from a car accident or a crush injury, right? How are we going to restore the nerve function? So that's one way. Vasculogenic is another cause of ED, which is really just, it's a vascular problem, right? So lack of blood flow to our pelvic floor structures when we need it to be there, which can be caused from, actually quite a few things. It can be from long-term opioid use. It can be from smoking, drinking alcohol can restrict blood flow over time. Some cardiac medications too. So there's a lot of causes of vasculogenic problems. And then there's like myogenic or hormonal. Myogenic myo means muscle, right? So it could be a muscular dysfunction. If I'm constantly tight and under tension all the time, that can be my issue on why I might have ED. And then for hormonal, that is directly related to, my body's hormones. And do I have, super low testosterone, and does my body not even have enough testosterone to maintain an erection? Then that's when we would refer out for the lab testing. If we have no clue what their levels may be, it's important to have that at baseline.
Okay.
Or you can actually have mixed problems as well, which could be, more than one source. And how are we going to treat that first?
Yeah. So how does you mentioned like laser can help quite a bit with helping to improve blood flow to the area, shockwave therapy. What are some other like techniques, or how can physical therapy help with treating, say, erectile dysfunction specifically?
Yeah. So, for example, if we have like a myogenic issue, right? If we don't have control over our pelvic floor muscles to contract at the right time, we have to learn how to control that, right? So we need to work on exercise and work on soft tissue treatment to learn how to contract and learn how to relax. A lot of times I'll put people in, whatever position they think they're going to have essentially the most sex in, and how are we going to make that contraction translate into those positions, right? So if I start on my back and then we need to work on a quadruped position or a hook lying position, we have to be able to function and control our muscles in those positions to be successful. And a lot of times I'm asking for a really high amount of repetitions, right? So 4 sets of 15 and holding for 15 seconds. And then once we are successful in one position, I'm going to translate that and make it harder. So incorporating squats or deadlifts into further exercise and saying, okay, can I control my pelvic floor in these positions now? Because then once I have that good connection, I'm going to be more successful and translate that into other parts of our life.
Yeah. And so would you say for those people who've had, say, like physical therapy before, right? Obviously, would you agree this is going to look quite a bit different than, say, if they've had, I don't know, your typical physical therapy place? How does it look different than just going to your normal physical therapist? Other than obviously you're doing the testing and you're targeting specific structures. Is there any other ways that really this looks different than what you normally would see if you've been to physical therapy before?
Yeah, so I guess it depends. If they've done pelvic floor treatment somewhere else, it may look different if they haven't ever used laser. But a lot of times, exercise, breathing, soft tissue work, cupping, dry needling of the hip flexors or the low back. If they haven't tried any of that in treatment, yes, definitely this therapy could look very different from them if all they've worked on is, breathing and relaxing. And that wasn't successful, we need to try something different. So our treatment here might look a little different than, treatment they had 5 years ago somewhere else.
Yeah. And it's all
We're
pretty
always trying
private
to,
though, right? As
oh
far
yeah,
as how that goes, like they're not going to be in an open gym talking about their issues with, other people around.
right. No, absolutely. All of our treatments at Fuel are one-on-one. You're in a private closed room. We make it as as comfortable as we can with, sensitive topics to talk about. But yeah, it's all one-on-one treatment, usually 60 minutes or so too. So you're in there for a long time with me, and I'm helping you understand and learn like what your dysfunction is and, how we can best help you to help yourself.
Yeah. And then, this has been super, super helpful. Is there any success stories that you can think of, where you were just got really good results, and like, what did that person's story look like? Just curious. Obviously, don't give any names,
Right.
like that, but any success stories you can think of?
Yeah, absolutely. So I had recently had a patient who had a crush injury. Actually, he went to therapy. They addressed his, general crush injury at first. He had a pelvic
Where was the
crush injury.
crush injury? Are you allowed to? I don't know if you're allowed to disclose that
Yeah,
necessarily.
it was in his pelvic girdle. So
Okay,
like on his iliac crest.
so the hip
So
area for people who don't know
yeah, so
there.
the hip area. Um, and when he went to therapy, all they really had him do was work on general mobility, bike, ride the elliptical, do all these really basic, essentially exercises that, yeah, we're going to get our general mobility back, but you're not addressing any of the pelvic floor dysfunction. You're not addressing any of the soft tissue tightness. So, him and I started really digging into, what can we do to improve your hip mobility? We treated that. What can we do to improve your hip rotation? We treated that. Um, Once those started to function better, now our pelvic floor is functioning better. And he was so happy that him and his wife actually like took a European vacation. So
Oh,
he's like, "Oh,
nice.
we're gonna go celebrate and do a bunch of fun things in the bedroom." I said, "Great, I'm glad I could help you out." Um,
So
so
was his main
really,
issue like erectile dysfunction then, would you say? Or
yep, it was erectile dysfunction essentially from the crush injury and not treating any of the myofascial restrictions that was present with the scar tissue buildup after surgery.
wow. Yeah, I mean that's just crazy to me that that wouldn't have been addressed like at all. You know what I mean? That you just let someone go through like that. And maybe they didn't know, maybe they didn't ask the right questions or something like that. And like you said, it can be a pretty sensitive topic to talk about. So yeah, I think it's very important for people to know that there are things that you can do. There is
Mhm.
hope for you. Um, what's the best way? So if someone needs to contact you and wants to, if they have a question or anything like that, what's the best way for them to contact you?
Yes, absolutely. So the best way to contact me personally is to email me. That is my name, matt.zitny@fuelphysicaltherapy.com. Or you can give us a call, and Susie, who works with our like front desk, is fantastic. She'll get you in touch with me. Um, you can also look up our information online at fuelhealthandwellness.com. So a lot of information on our website. You can also learn how to schedule an appointment on there. So we're pretty easy to find and reach. So should be not too hard.
Perfect. I will make sure. So if you're watching this, say on YouTube or Facebook or whatever it is, I'm gonna put the your contact information in the description. So be sure to look for that there. And if you have any questions or want to get a hold of Dr. Matt, be sure to reach out to him. Yeah, Matt, I've learned a ton from you. I really appreciate everything that you bring to the team, that's for sure. And I agree. I think I didn't even know really until I'd met you that this was a specialty, which
Yeah,
is crazy. And I'm in the field, right? I didn't know it's
right.
of a specialty. So if I don't know it and I'm around the in the health field, there's got to be
Yeah,
so many people who don't. And so I really think that there is hope for you, because as you know too, the statistics with anxiety and depression surrounding this are crazy. And then like
yeah, they're
even
huge.
um, yeah, I think didn't what are the do you have any quick anxiety depression stats on this and that you know off the top of your head?
Yeah, so I've read in some recent studies that like 50 to 70% of men who commit suicide are actually have pelvic floor dysfunction, which is actually one of the reasons why I got into it because it's like, okay, this is something that's hard to talk about. People should be able to be treated for it, right? So we need to create a comfortable space for them to be open and talk about it. Not, ending your life should not be their cause from erectile dysfunction, right? So there's so many other avenues than that, which
Yeah.
is super important. It's very eye opening.
Yeah, no, that's crazy. So yeah, so like I said, there's definitely hope for you. Feel free to reach out to myself or Dr. Matt, if you um need any help. But he's definitely our go-to resource. So thanks for so much, Matt, for coming on, and we'll definitely have to hit on some other topics with this here in the near future.
Yeah, absolutely. Thanks for having me on, Eric. I appreciate it.
All right, no problem. We'll see you, man.
See ya.
Bye.